एंग्जाइटी के बारे में, अबाउट एंग्जाइटी. अब ये एंग्जाइटी जो है ना काफ़ी नॉर्मल है. दिस इज क्वाइट नॉर्मल. एवरीबडी गोज थ्रू दिस फेज एंड it's basically, yes, like I told you, it is a feeling of fear or a feeling of uneasiness. Sometimes it can be normal reaction to a stress. For example, you are facing an exam, you are going for a lecturer, or I am giving a lecture. Before a lecture, there is a lot of anxiety. So this is quite normal, and anxiety, if it goes out of control, and if anxiety is in relation to a specific disorder or a specific symptom, then you can think of giving the remedy. See, there are some common symptoms of anxiety, like difficulty in concentration, feeling irritable, palpitation, sweating, trouble in sleeping, having a sense of danger. These are quite common symptoms of anxiety. So anxiety, in a sense, there were a lot of queries on my WhatsApp videos and all, okay, something about anxiety, but anxiety is quite common and everybody goes through that. Unless it is very defined, it is affecting the day-to-day routine, then you must think of taking that rubric for prescription. Okay, so welcome Dr. Bharat Abdul Khatri, Dr. Bari, Walaikum Salam. For example, I'll tell you one case. There was one case where the patient says that he was a government officer working, and he said, I have to attend a lot of people, lot of high rank people, and a lot of people, and have to do this, do this. Sometimes I become so anxious. What will happen? I have to give an answer to this, give an answer to that person. That was a summary of the case. Hello, Dr. Babal. And I told him, what do you do when you become anxious? This is a very important question. You have to ask that person, what do you do when you become anxious? So he said, okay, whenever I become anxious, sir, I feel my whole energy is going down. I go to the gym, I do rigorous gym, I do cardio exercise, I do weight training, and I feel relaxed. My anxiety calms down. This was the case. Very important to ask, what does the patient do when he feels a lot of anxiety? So I prescribed the patient with adding one or two symptoms, iodine. I gave iodine 1 mg single dose and waited for some time, and he reacted beautifully with medicines. Iodine 1 mg I gave. After 1 month, he was much better. I think he's still under my treatment. I have only repeated iodine 1 mg once, and he's much better. So this is an example where you have to prescribe on anxiety because it is hampering the life of the patient, hampering the day-to-day activity. Hello, are you with me, everyone? So before I go to the next anxiety rubric or condition, I'll take one case. Sir, नर्व डैमेज है, इससे बॉडी बहुत वीक है, वर्टाइगो भी है, कुछ काम नहीं होता है, थोड़ा भी चलता है तो नर्व सेंसेशन होता है. Whatever I can understand, Dr. Khatri, he wants to tell that there is a nerve damage and because of that there is a vertigo. Now see, whenever you have vertigo and there is a damage to nerve, also you can take a nervine origin vertigo. There are few medicines that come to my mind. The first is Naxomica, second is Ignitia, third is Rustox, fourth is Gelsemium, and fifth you can think about is Camphor. If with these 5 medicines, of course, then you have to try to differentiate these remedies by few symptoms so that you're able to have the proper remedy. These 4-5 remedies I have seen in my practice, they give good results, whatever I can think now. But these 5-6 remedies are very important to understand and then prescribe depending on the symptomatology. Okay, so let's go forward. One more case I'll discuss about anxiety. Now I told you, ask what is happening because of anxiety. Now this patient told me that I go to the gym, I do rigorous exercise, and I feel much better. Okay. I have one more question. Sir, please suggest medicine for vertigo, turning in bed and during namaz in sajda position. Now see, if you see, this type of vertigo, this is very common, Dr. Bari. Vertigo on doing sajda. a very, very important remedy. You must always think about first remedy when you see when I am late in the clinic, there's a lot of rush, I have no time, and if this symptom comes to me, I first think about sulfur. First think about sulfur, second think about histamine. Histamine is a very important medicine, vertigo when doing namaz. Third remedy you must think again, it is a very rare remedy but I have used with very, very good result, that is Hedera, Hedera, Hedera helix, common IV. Fourth, you can think about Moxol also. Okay, so let us go forward. I was telling you about that iodine case. Now one case, he told, sir, I become so much anxious about some works, about something to do, something to event is coming. I become so anxious, and you know what I do? I become so tired, and I just go and rest. So this was the case of the patient. Of course, there were other symptoms. This is the summary of the patient. If anybody can tell me what symptom you have to take for prescription and what can you think in this case. डॉक्टर साहब इतना सोचता हूँ कल क्या करना है, परसों क्या करना है, उसके बारे में क्या करना है, वाइफ के बारे में क्या करना है, बच्चों के करियर के बारे में क्या. आई गॉट बिकम सो एंशियस व्हाट टू डू. आई बिकम सो टायर्ड, आई वांट टू गो एंड स्लीप. This is the gist of the case of the patient which came to me. So what remedy can you think about, or you can think about what symptom to take for prescription. That is very, very important. Anybody? By the time you start thinking, it is very important to understand. Unless you give me your feedback, I will not be able to judge what is happening. क्या सोच सकते हैं? So I took the rubric. Anybody? Anxiety, very, very common symptom in day-to-day practice. Lot of case, in fact, every case would have that anxiety symptoms. This is what the patient tells you. What you can think about, anybody? क्या सोच सकते हैं हम? There is a very important rubric in a mater medica. Overthinking, coffee. Very good, Dr. Bahari. At least keep trying. Now, what is the patient telling us? After thinking, after anxiety, I become so tired, I have to go and sleep. This is the working of the patient. So Dr. Khatri says urgentum nitricum. I'll give you a case of, very well said, Dr. Saab. I'll give you a case of urgentum anxiety. Okay, I'll just हमारे टॉपिक से दूर जाएंगे और हम कोशिश करेंगे अर्जेंटम नाइट्रिकम के लिए सोचने के लिए. एनीबडी इसके अलावा कुछ सोच दिमाग में आ रहा है? एनीबडी? एक पेशेंट आ जाता है, he comes and tells me, doctor, I have become so anxious, I have to do this, I have to do that, I cannot think, I become so anxious, I just faint. And that, Dr. Khatri, is urgentum nitricum. Hello, are you with me? Are you understanding what? See the wordings of the patient. Anxiety with faintness. Urgentum nitricum, spongia, and crotalus horridus. I have never failed when I have taken this rubric. I have never failed when I have given one of the three remedies depending on the case. That is urgentum nitricum. But that patient which I told you, that anxiety so much the patient becomes tired, he wants to go and sleep. He is not fainting. If he faints, urgentum nitricum, spongia you can think about. But this patient becomes tired, exhausted. So the rubric for this patient would be anxiety with exhaustion. And the only remedy you must think about is magnetis pollis. Magnetis pollis, a very rare remedy. It is not rare, of course, we have been not taught, but then in day-to-day practice, you come and read this remedy. Magnetis polli ambo, both poles it is. This is anxiety with exhaustion. Are you with me? Everybody, are you with me? Otherwise, what will happen, we always think about arsenic. Now, when do you think arsenic, Dr. Barbal? If I give you a case, when you should think about arsenic for anxiety? Anybody? Just think over. I'll give you one more example. A patient comes to you and tells you, Doctor Sahab, I want to work free. मुझे फ्री में काम करना, कुछ बंधन नहीं चाहिए. I don't want anybody to tell me something. If you tell me, see, tomorrow 8 o'clock you have to get up, for the flight. Tomorrow, 6 o'clock, you have to get up because you have a train to catch. After 2 days, you have to give a seminar, so be prepared. Now, if this comes to your mind, and what is this symptom I'm talking about? Anybody? What is this symptom I'm talking about? What did I tell you? The patient says that I want to live free. I don't want any bounding. If somebody tells me tomorrow 8 o'clock you have to catch a train, please get up on time. Or tomorrow 6 o'clock you have to catch a flight for Bombay, please get up on time. Or after 2 days you have to give a seminar, be well prepared. Or you have to go to the parents teacher meeting, be prepared after a week. So the patient tells us, I don't like this, doctor. People telling me do this. If somebody tells me I have to wake up at 6 o'clock for the morning flight, I will not get up only. I will not sleep only. मुझे एंग्जाइटी नहीं करी रही क्या 6 बजे जाना 6 बजे. And if you don't tell me I have to get up, I can get up very easily. Don't tell me the remedy first. Tell me what is the patient trying to tell you. See, remedy can change, but you have to understand what is the person or what is the vital force trying to tell you. What does it tell? If you don't tell me that I have to get up at 6 o'clock, I'll get up aram se. I'll get up without any problem. But if you tell me, see, tomorrow 6 o'clock you have to get up and be prepared, then I'll not be able to sleep only. This is what the patient is telling you. So what can you think about? Don't tell the remedy first. What is the patient trying to tell you and what symptom it makes? Anybody? आप लोग तो मुझसे सब सवाल पूछते हैं, मैं भी कभी कभी सवाल पूछ सकता हूँ ना. So just think and just tell me. Now let us go further. Anxiety. There is some anxiety called you anxiety. I've always told you, see what the patient tries to tell you. Anxiety with exhaustion, anxiety with exertional rates, anxiety with faintness. There is one more anxiety. Anxiety with formication. Doctor sir, whenever I am very worried, stress, I get formication. मेरे body में पूरी चींटी आ जाती है. Okay, then that is a one or the other form of anxiety. Okay, then you can think about Yavatmal or Econat or sister scan. So Dr. Bharat says elements from anxiety. Okay, anxiety of anticipation. No, this is the beauty of our mathematica. This is the beauty of our rubric. What is the patient telling you? If the patient says, if you tell me to wake up at 6 o'clock in the morning to take a flight, I'll not sleep because I'm anxious. But if you don't tell me, I know what to do, I'll get up automatically in the morning with no problem. This is what the patient is telling you. So this is elements of anticipation or anxiety of anticipation. Okay. Can you think something more? Okay. So I'll come to you. Keep thinking and keep trying to answer. Okay. Because there are a lot of remedies for anxiety of anticipation. There are a lot of remedies for anxiety, elements of anticipation. But this rubric has only one remedy. I'll tell the rubric also. So understood, anxiety with formication. Do you get these type of patients in your OPD? That is very important. See, unless you tell me, yes, sir, these are there in my OPD, so you'll understand. And we are talking clinical mathematics. Whatever I have seen in my practice, I am just trying to tell you. So anxiety with formication. Now one anxiety. Anxiety after fright. Anxiety after fright. Matlab, the patient has had some frightful event, frightful incidents, and he becomes very anxious. Now what will happen? What will happen? Somebody has called me and somebody has met with an accident and the anxiety starts. Now what will happen? What will happen? What will happen? Somebody has told something bad about somebody, then again anxiety starts. Somebody, I have gone to the doctor and the doctor says that you are suffering from this disease and the anxiety starts. So anxiety after fright. Very, very important remedy. Calibrome, ignitia, silicia, viratramalp. Hello, are you with me? Are you understanding? Anybody? And then this anxiety remains for a very, very long time. The patient is not able to forget that something frightful event and that has taken the toll of his life, and he has not still forgotten, and because of that he is suffering from lot of problems in life. So what is this called as? Anxiety after fright remaining long. And you always think about ignitia, you always think about natramur, but neither natramur will work nor ignitia will work. Belladonna, Cilicia, Lachesis. These are the remedies where anxiety after fright which remains for a long time. Wonderful, wonderful rubric, wonderful, wonderful remedy which works. So don't be prejudiced every time we think about ignitia or natramur or aconite. Homeopathy is much more than what we can think about. So I'll give you the answer of that anticipation which you are telling me. Again, I'll repeat that symptom what the patient tells. The patient tells, if you tell me 2 times, 3 times, get up in the morning because you have to catch a flight, I'll not sleep the whole night. But if you don't tell me, I know what to do, I'll easily wake up in the morning. The rubric for this, please write down in your notes. Anxiety when anything is expected from him. Hello, are you with me? Anxiety when anything is expected from him. For example, the patient comes to me and tells me, Doctor, I know you have cured this thyroid before also, and I know you also will cure my thyroid. I hope in 3-4 months I'll be better. And then your panickiness starts, anxiety starts. Oh my God, now he's expecting because he has been referred by somebody who has already been cured with me. And then the anxiety starts. Are you with me? Everybody? Anxiety of what is expected or anxiety when anything is expected from him. The only remedy in the repertory, if you open the rubric, the remedy is arsenic album. This is the importance of knowing the rubric in the exact form. Arsenic, of course, Dr. Khatri got the answer right, arsenic album, but the rubric is very important. Everybody was talking about elements from anticipation, anxiety from anticipation, but this is what is expected from him. If then is the case, then you have to take this rubric and prescribe. The remedy is arsenic album. Everybody, are you with me? अरे समझ में आ रहा है कि नहीं? Yes or no? Of course, I will take your answer. What is this? Dr. Singh says, nerve neck problem. ये तो बड़ा ही देखिए बड़ा ही इजी प्रॉब्लम है. आपको शायद नर्व का प्रॉब्लम हो जाए, शायद कॉर्ड में कॉम्प्रेशन हो जाए, तो हो सकता है कि प्रॉब्लम हो. ओके, ठीक है. इसके लिए बहुत सारी दवाइयाँ आती है. बहुत सारी आती है. अगर आप मुझे एक क्लासिकल सवाल पूछेंगे इसका सिम्टम मोडेलिटी, तो मैं आपको अच्छे से आंसर दे पाऊंगा. बट ये मोडेलिटी सिम्टम में आप मैकफॉस सोच सकते हैं, सिमेसिफोगस सोच सकते हैं, रस्टॉक सोच सकते हैं, हाइपेरिकम सोच सकते हैं, बहुत सारी दवाइयाँ है. Dr. Bharat, okay, thank you. What about Vashi? Okay, so have you ever heard of this rubric? Anxiety when anything is expected from him. Very, very important. Should high potency be used? No. Normally, Doctor, whenever I start the case, even if anxiety, even if it is classical, I start with 200 and after 15 days, I give 1 potency. This is how I approach the case. And if your rubric is right, if your remedy is right, it would definitely work, sir. But I start with 200, then after 15 days or after a month, depending on the feedback of the patient, the follow-up, I give 1 potency. What is expected of me is me and my anxiety. My anxiety is 25 years old. Please tell me power of arsenic album and dosage. Akshay, if you are feeling that you are arsenic album, in fact, whenever I teach something, everybody will feel that he is that remedy only. When we used to study Kent Mater Medica, we used to feel this is our remedy only. But still, अगर आप डोसेज पूछ रहे हो और 25 साल की एंग्जाइटी है डॉक्टर अक्षय, so it is very important you start arsenic LM potency. Start from arsenic LM 0/3 twice a day. Then after 15 days, see how is the result. Then you can arsenic alb you can take once 0/4 once a day. Then maybe arsenic alb 0/5 once in 3 days, 4 days, depending on your follow-up. Automatically you can start tapering of the doses. Okay, Dr. Akshay. So okay, so anxiety. अभी बहुत इंपॉर्टेंट है ये क्या सवाल है? For the male sexual problem ED, does homeopathy medicine work? How many days it takes to show the result? Rahul ji, see, homeopathy would work, Dr. Rahul, for any type of cases, every type of cases, depending upon the chronicity of the complaint, the what you call the purity of the case. It depends on that. How will the patient react with the medicines? Is there any hope for polyneuropathy clonazepam induced? Dr. Imran, if you ask me, I'm a very positive person for homeopathy, and I have seen wonderful results in cases, in diseases which were terminally ill. In fact, today only I got a case of chronic renal failure. The creatine was 6, then it went to 4, now it is 2.3. Wonderful result, with this type of cases. So my only suggestion to everybody would be, take a good case depending on the miasm and then repertorize the case. The quantity of rubric you take for prescription is not important. The quality of rubric you take, depending on the miasm, that would decide the follow-up of the case. Okay. So there is one question on the WhatsApp. I'll just take the case. Okay, you can write the question on the Skype. Is there any? Yeah. So I hope it is. I hope you got the answer, Dr. Imran. Whenever you get something, on the answer, please tell me some 100% or something, so that I know that you're understanding. Otherwise, it feels as if talking to my computer. Okay. There's a question from Dr. Abdul Rauf. Sir, a patient with gastrocardiac syndrome, any medicine? See, Dr. Rauf, gastrocardiac syndrome. So you have told me the diagnosis, but in this syndrome there are lot of what you call symptoms, or which the patient will suffer from. The patient with this syndrome will not have that only one symptom, lot of symptom. So depending upon the gravity of that symptom, I would be able to answer better. So if you can write me something more about the question, I'll be able to answer it better, Doctor. Okay. Otherwise, the symptom based on the severity. Like for instance, in this case, the most common symptom would be acid reflux and bloating. So there are simple medicines for acid reflux and bloating, but there is a cause for this. So if you are able to tell me the exact cause, I'll be able to answer better, Doctor. What is the main difference between homeopathy and allopathy treatment? After reading on internet, I found that homeopathy fixes the see basically Dr. Rahul, हम एक grand बोल सकता आपको कि homeopathy treats the man in disease and the other pathy treats the disease in man. For example, if a case of hypothyroidism comes to me, allopathy doctor would see the report, okay, the TSH is now 20. If you're taking 50 milligram, take 75 milligram. So the thyroid will be cured. If a patient comes to me, I'll see hypothyroid. If it is 20 mcg, why the patient is suffering from thyroid, I'll take the whole case and then prescribe on the personality. So for me, every case of hypothyroid may have different remedies, but in allopathy, the remedy is same, thyroxine, the potency will change. That's the basic difference. Sir, a woman with 2 children had big uterus tumor and the patient was so panic for operation, but I gave medicine and she is ready for operation. It is really unbelievable. Very nice, Dr. Saab. And which remedy, Dr. Feroz, you gave, please share it. And it's very encouraging for me also and everybody that you are getting good results. Keep sharing the results also, okay? Yeah. So Dr. Nitin says, sir, also kindly tell some medicines for severe cough with mucus in chest. I think this is very common problem, with mucus in chest. And see, what will happen if there is lot of rattling, lot of rattling. I think you are from Delhi. I think all Delhi people have a problem because there is so much of cough problem in Delhi that everybody is suffering from those allergic problems. I think. Good afternoon, Dr. Lalit. Good afternoon. Sir, kindly tell. Okay, so I'll just tell something medicine for first cough, Doctor Sahab, and then I'll tell you something worthless. I've told you before, last YouTube only. Rattling of chest. Of course, everybody knows antim-tart. Rattling of chest, first we think antim-tart. But you'll be surprised, dosto, you'll be surprised that rattling of chest is also present in Kali Sulf, in Naxomika. Dulcamara, belladonna, Seneca, phosphorus. So you have to first see how is the rattling, when is the rattling, what is the modality, how is the expectoration, the time of expectoration. So if you see these type of remedies and then make a chart, automatically 4 or 5 remedies should come in your mind. Otherwise, in homeopathy, Antimtar, Ipecac, Coccus cacti, these are so frequently prescribed that you might get result, you might get result also. So make a chart in your OPD only, that rattling, 10 remedies, expectoration, easy, late, and the time. Automatically your prescription would be very good. Okay. That worthless feeling I've already told you in the last YouTube. You can please check in the last YouTube. Okay. Sabadilla also, yeah, Sabadilla. See, there are a lot of medicine, doctor. Sabadilla is also there. But rattling, if you ask me, so rattling में Sabadilla का action बहुत कम है. I have never not given Sabadilla so frequently in my practice. Okay, whatever I have given, I have told you in my in the last answer. Sir, 41 years, bloating after food, indigestion, flatulence, not hungry, food particles. See, डॉक्टर साहब भारती जी, सबसे मेन है, हम जो ब्लोटिंग मेडिसिन जब यूज करते हैं ना, होम्योपैथी में बहुत कॉमन रहती है. एक तो है कार्बोवेज, एक है लैकोपोडियम, एक है चाइना. इसके अलावा यू कैन थिंक अबाउट ग्रैटियोला, गैम्बोजिया, आयरिस versicularis. Sir, kindly tell some medicines for anxiety with घबराहट, feeling together with depression and worthless feeling and insomnia. Oh my God. मतलब with anxiety, the patient is becoming so panicky, and that's the entry point of this case. Panicky power overpowering, and then the remedy would come. I'll just discuss one case. नितिन, I'll discuss one case. मेरे पास एक पेशेंट था, वो बोलता डॉक्टर साहब आई बिकम सो एंशियस, मैं चलते चलते गिर जाता, सोचते सोचते क्या होगा, कैसे होगा, क्या होगा, व्हाट विल हैपन, आई बिकम सो एंशियस while walking, I just fall down. So panicky. I just gave one dose of one remedy. Believe me, with that one dose of the remedy, patient got cured. He's coming to me for the past 6 months. I have only given that medicine one potency, one dose. Tell me the remedy. So this is a question for all of you. Okay. That's the thing, Dr. Nitin. Kindly repeat the medicine if possible, as nothing has having anxiety and घबराहट. Yeah. See, what happens? You have anxiety, okay, and I always told you, anxiety followed what? So there are lot of things with anxiety. But if I tell you anxiety, I'll take 3 or 4 hours to tell about anxiety. But let me, okay, if you want palpitation, घबराहट, you can write some remedies. But वो remedy मुझे बताना, पेशेंट को इतना the patient is so anxious, he falls down. That was the case. So I just tell you something about anxiety with palpitation, घबराहट, phosphoric acid, natramur, pulsatilla, digitalis, crataegus, China. Okay. No, it is not aconite, doctor. And you'll be surprised, Dr. Nitin. The remedy which I am talking about, anxiety is so much, the patient falls when he is walking. The remedy is natramur, doctor. Natramur. 1 I gave that patient one dose. For the past 6 months, is coming to me, no problem, not repeated even single time. This is the beauty of our medicine, the beauty of taking symptom, the beauty of repeating. Okay, Dr. Sahab, current happening medicals. You're doing MD from Lucknow. Okay, welcome. Patient is teacher and having anxiety of going to stage and neck. Is stiff, suddenly unable to turn, others, and trembling of the body. Okay. So what a very interesting symptom. Teacher, teacher having anxiety, so much anxiety that the patient is not able to become stiff. This is a very, very, in fact, if you ask me, whenever I also go for a webinar or for a lecture, I also have anxiety, but when I start, everything is fine. So in this case, you can think about 3-4 remedies which are very, very important, doctor. Think about hyoscyamus, think about stramonium, think about belladonna, think about aconite. सर, पेशेंट एनीमिया 7 पर एनी मेडिसिन कैसे, क्या बताओ डॉक्टर भारती, एनीमिया के लिए अगर कुछ भी नहीं समझ में आ रहा, गिव फेरमफॉस. आजकल एक नई मेडिसिन निकली है, देयर इज अ न्यू मेडिसिन, हीमोग्लोबिन. Give hemoglobin potency, 6x potency repetition, it should work. Difference between natrum mur and aurum metallicum. Natrum mur I told you, aurum metallicum patient will not tell you, कि I have anxiety, I have stress. He will silently prepare for suicide. किसको बोलेगा नहीं, आवाज नहीं करेगा, शांत रहेगा. और सुसाइड मतलब कुछ खाएगा नहीं, पिएगा नहीं, आराम से शांत शांत चले जाएगा. और मेटालिकम केंट में एक वर्ड दिया हुआ है, साइलेंटली प्रिपेयर्स फॉर सुसाइड. नेट्रमोर में अगर आपको बताया होगा on in my November webinar, I have told you Natromur, psychic cause of disease, psychic cause of disease. If you go and read Boric Mater Medica introduction, mind के अंदर psychic cause of disease. Are you with me? Yes. Jai Hahnemann, Jai Homeopathy. So we are already half an hour up, and thank you for being with me, and I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you. Bye bye. Until next Saturday.